Good morning, Dr. Kapoor. Welcome to the podcast.
Good morning, and thank you, Avish, for inviting me on this podcast.
It's our pleasure, sir. Um, Before I ask you a few questions, if you can give a quick introduction so that everyone can get to know a little bit about you.
I thought it will be better if you give me the introduction about me.
No, I have already given an introduction to everyone, and everybody
Okay.
is super excited
Yeah.
to get to hear from you in person.
So I am Dr. Raman Kapoor. I'm a medical doctor. I did my MBBS way back in the 70s, 79. And thereafter, I pursued acupuncture as a career. I went to Beijing and did a course in medical acupuncture. And thereafter, I started practicing acupuncture. Initially, it was a big struggle because this awareness was very poor. Even now, the awareness is not as great as one would like it to be, but still, people know about acupuncture. And uh, now it has been 42 years that I've been practicing acupuncture in New Delhi. And I've had the great opportunity to be having a wife also who practices acupuncture with me. She is also an allopath, turned into acupuncture. And now my elder son, who's an anesthetist, and now turned into acupuncture. So all three of us as a family are only into practicing acupuncture. I also happen to head the Department of Medical Acupuncture, which I developed myself about 28 years ago at Sir Gangaram Hospital, which is a very premier hospital in Delhi, and also happens to be the only hospital in India where there is a proper department of acupuncture. And I was also lucky to have been awarded the prestigious Padma Shri in 2008 for my work in the field of acupuncture.
Excellent. Thank you so much for sharing that, Doctor. I want to jump straight into it. So, as I discussed with you, the original idea of asking you to come for a podcast was because I teach at all these colleges. And, something that always bugs me is that I'm a technical trainer. So, students are working on their laptop for the entire day. And, they can't see it, but I can see it the way they are hunching over their laptop. And, I keep on reminding them. I sometimes shout at them to get a stand. At least the one thing you can do immediately in the short term is to have
Hmm.
a slightly higher eye level.
Hmm.
Um, but to be honest, I'm not sure what the solution is, right? We continue to work more and more on our laptops, on our devices. Maybe on the personal devices like a smartphone, there are
Hmm.
still certain things you can do to control it. But
Hmm.
on one side we have Mr. Narayan Murthy saying work 70 hours a week. So as a student, it's so confusing. We don't know, should we work hard? Does it take a toll on our health? So I just want to get your thoughts on it at the age of, let's say, 20 to 24, right? Where you are full of energy and you want to work hard, burn the midnight oil, and you should. How should you balance your work and your health? And what are the small things that you can do to take care of your health?
I think the first and foremost thing which I would like to talk about as a medical doctor is that we should know the faulty postures which we are going through nowadays, particularly with the tech taking over our lives. So there are four postures uh, in our body which are wrong and which are causing a lot of problems. The first one is uh, a forward bending of the head. You can see me, I am doing it for you.
Right.
So the forward bending is when your head is positioned with your ears in front of the vertical midline of the body. So this is the vertical midline of the body as I sit. And if I do it like this, your ears are going to fall forwards in front of your vertical midline. Now, this is an alignment which is out. And this is also known in our medical jargon as a tech neck. You can call it a text neck or even
Right.
a nerd neck. So these are the three names which have been given to this condition, which is being caused due to a forward head posture. And this generally comes due to hunching over a cell phone or a computer or your steering wheel if you drive a lot. Because you see what happens, if you're driving straight, you are okay. But after some time, your muscles then tend to get a bit tensed up. So you tend to go like this. And then you start driving like this. So this posture can be caused because of three reasons, as I said to you. One is overworking on the cell phone. Second is overworking on a computer. And third, as I said to you, driving for a long period of time. But having said that, uh, it is not that I don't use my computer or I don't use my cell phone, but we have to understand a very simple philosophy, which I'll tell you in few seconds, and everyone, including you and myself, have to follow in our daily life. And it is very simple that first, as you rightly said in your beginning comment, that you need to have a station wherein you can keep your laptop so you don't have to go like this. So your eye level and the level of the laptop at which you are working should be the same.
Right.
Second and most important is, do not do any work on a cell phone or a computer, anything like that, any device, even watching television, lying in bed. You see, because in bed we tend to go like this, sometimes like this, and then that neck muscle. After all the muscles of the body have been made by the same God. And he has made the same muscle for everybody. So it's not that one guy's muscle may be so strong that he can continue misusing it and still expect nothing to happen. Maybe uh, if you are an athlete and your muscle buildup is strong, you may last a few months or maybe a year more than probably Havish. But ultimately, everybody will end up in the same problem. So try and understand that the muscles are the same. And if we overtire the muscles, the natural tendency of the body would be to go into a position like this. And as we go on working in that position, then that posture becomes permanent. So we call it as a forward head posture. And
Right.
this can also result from an aging process also, naturally also. But when you see this at young age, and I get a lot of young people coming to me. So the major thing is, this is the first posture which I told you, which is wrong. The second posture is when you go on doing this with your cervical spine, which is the neck area, then the same posture goes on affecting your thoracic spine, which is the part of the spine just below the cervical spine, which is also we call as the upper back. And then the shoulders start getting rounded up, and we develop what is called a hunchback. So I'm going to you with one and then a hunchback. So the
Right.
shoulders will get rounded and the spine will become hunched. So this is called a hunchback and also known in our medical jargon as kyphosis. Now, younger persons may develop kyphosis also as a result of some disease processes also. But by and large, today we are talking about posture. So let us focus ourselves on the posture part. So this is the reason for chronic bad posture leading to first the forward head, second now the kyphosis. And then the third position is when you see a person in front of you, he's standing in front of you and he's got his hip and pelvis tilted forward. You'll see a lot of people walking with their hip and pelvis tilted forward. And this is called lordosis. So lordosis also develops because of bad posture. When you go on, suppose you are teaching and you do not rest in between your teaching sessions and continuously for a long time you are standing, then what happens is the muscles again start getting weakened up, and then we develop this position where the hip and the pelvis starts tilting forward. So this is what is known as a sway back and also as lordosis. And then the last is the position of our lower back. Now that lower back also has a tendency to develop because the spine ends in the lower back and the the lumbar spine and the last part is the sacral spine. So in the lumbosacral spine, when we develop degenerative diseases, and nowadays I'm getting young people developing degenerative disorders of the disc, prolapse disc, sciatica. So that is also being caused because of the normal curve of the lower spine. You lose that curvature. So your lower back looks straight and then you tend to stoop forward. So there's a stooping forward. And this flat back can make it very painful for you to stand for long periods. So if you stand, so maybe half an hour, you may be comfortable. After half an hour, you're looking for a chair here and there in the crowd or in a party or in a function where you want to sit down. Why? Because the lower back muscles have gone tired. So these are four things which are very important to understand, the four postures. And now we come to what are the effects of this bad posture on us. So this first I told you the positions of the bad uh, posture, and now we come to what is the effect. So the first effect is of, as we rightly said, the forward head posture, and that patient will present with, or a student will present with neck pain, stiffness, and another symptom which we so many times miss it and say, oh, you got probably migraines. Mistaken as a migraine is occipital headache, which can actually then start transferring to the frontal area, to the temples, and sometimes to the vertex. So all these problems are related to the cervical spine. So what happens is, when you do on doing text, eh, all the time texting, your text neck develops tight muscles, and their supporting ligaments and tendons in front of the neck lengthens the muscle structure at the back of your neck. So as a result of which, the sternocleidomastoid, the scalenes, and the trapezius. These are the three muscles which take the maximum impact. And then we start developing this all the time. Posture will become bad, and constant pain, niggling neck stiffness, niggling problem of headaches. So, and sometimes, individual think that probably it's normal because they think they have done a lot of work at night, but they are not understanding that the damage is already started happening. So, if we are looking at good health along with good work, that should be the aim. Not that only work, because that is not going to take us anywhere. At the end of the day, if your posture has been good, your health has been good, you will last a longer life and you will last a healthier life. Otherwise, you can see all around you people walking with a forward neck all the time, and even with that shoulder thing, as I said to you, rounded shoulders. So they develop extended curvature of the back becomes bad. And then finally, when the lower back gets impacted, because ultimately it is the same spine. Remember, it starts from the cervical, comes to the middle of the thoracic, comes to the lumbar or the lumbar spine, and then ends in the sacral spine. So any part of the spine, if it gets impacted, it will affect the other part of the spine also. So it's a gradual degenerative process, which we have triggered by bad posture. So the important thing to understand is, who's triggering it? Me, myself. So when that me and myself comes in, I think we have a role to play in the recovery part. Then the second is, which I talked to you, was that, and this is very important, the neck part. Because you see, in a neutral posture, when we are there, our head weighs about 10 to 12 pounds. That means the weight of the head on the neck is about 10 to 12 pounds. And when we do a forward posture of 15-degree out of alignment, just think, just 15 degrees, your spine, the load of the head on the spine increases to 27 pounds. And when you do this to 45 degrees, it increases to 49 pounds. And at 60 degrees, which is the normal position at which most of the students are working, it increases to 60 pounds. So imagine a neck muscle, which is normally made by God to take a weight of about head of about 10 to 12 pounds, is taking a weight of 60 pounds. So 6 times the normal weight which the muscle is to take, the head. We are giving that much of uh, punishment to our neck muscles. So what will happen? They will ultimately say, thank you very much. You are responsible. And so the symptoms will start coming in. So let us try and understand that why is it that we are more important than anybody else in causing these problems. Then I come to the next posture, which we talked about, which was the next most important position of kyphosis, which is again nothing else but a more extreme forward head posture. So initially we started like this, came like this, and then we became like this. So that extreme posture, so we call it as a hunchback, and this causes the amount of pain and dysfunction is very severe. And whenever you are severely hunched over, it is harder for you to walk, and you have an increased risk of falling and getting injured. And older women who develop this at a young age, then as they age out, they have a 70% rise of fractures. And this is a documented thing. So kyphosis can affect any age. It can even affect younger people, and the angle of kyphosis will continue to increase as we age out. So suppose you develop a kyphotic spine at the age of 20 or 25 or 30, you can imagine what you would be at the age of 70. So at that stage, we will probably not be able to do much. You see, because already the curvature has taken its shape. So I'll come to the treatment also as we go forward, how we can prevent these things also. Then the next thing is what we call it as the sway back position, wherein I said to you, the hip and the pelvis goes forward. So now this can cause back pain, this can cause pain in the hip joints, and then this affects our ability to move. So we find difficulty in movement. And this also increases the risk of, again, injuries to the back and the hip joint. And a combination of the pain in the neck with the pain in the lower back is very common in my practice. Why? Because all these people are chronic patients. They developed it at the age of 20, 25, never bothered, thinking they are the tech savvy guys. So let's go ahead, let's make the money. They don't realize that that money which they made ultimately will be used for their own treatments only. Because that is not health. That is something which we actually are creating for ourselves as a wrong posture, which will affect our system. And you see, try and understand, if your posture becomes, like I said, the kyphotic posture, that starts affecting our lungs. You see, because the heart and the lung cavity is also supplied by the nerves from the thoracic spine. Like the cervical spine supplies our arms and the fingers. The thoracic spine supplies our upper abdomen and the back and the chest wall, and the lumbar spine is supplies the nerves and blood supply to our legs, right till the sole of the foot. So the understanding has to be very clear. What supply line is going from where? So if our mid spine curvature gets bad, we get kyphosis there, and then what will happen is it will impact our chest health. So what will happen is we will actually see ourselves breathing with a lot of difficulty. So even if we walk for half a kilometer or 1 kilometer, we think we want to sit down. We are otherwise normal. But the first symptom which may present is young people saying, they start feeling breathless. And then they go to a doctor. And then the doctor may order all the echos and everything, and ECG, everything. And all the blood tests and everything is normal. But then nobody realizes that the curvature has gone bad, and as a result of which the amount of pressure on the chest wall is increasing, so the lungs are not getting its full area of expansion. So if they don't expand fully, you will start getting breathless. So sometimes a very a symptom like this can be missed, but these are symptoms which are going to gradually go on coming to you. And then the last is, as I said, from the hip and pelvis going forward, the spine. And then we also call it as a flat back syndrome, because when you stand up, it is hard for you to stand up without pain. And that pain then starts getting referred to your thighs and pelvic area. And pain and fatigue can increase the longer you keep standing. And walking may also become difficult. And this gives rise to pain in the legs and also weakness. Because as I said to you, blood circulation from the lumbosacral spine comes to our legs. So any type of restriction there will lead to symptoms in the legs also. Or blood supply is reducing. So this is why it's very important for us to understand the value of posture. Now, the simplest thing to do, which is, I think probably you may have been recommending to your students, but probably when it comes from a doctor, they may listen to it a bit more carefully, is change the configuration of your workstation, as Avish has been telling. Change your chair and the way you sit. Change the position in which you look at your cell phone. If you require, you may buy a new mattress to give more support to your back. Do not use a hard mattress. That is a wrong thing. It should be a firm mattress, not a hard one. and not too soft also. All these mattresses in all five-star hotels are a big reason for developing pain. I know a lot of my own son, who's a senior commander with Air Asia. He goes to a lot of flights where he is a layover and he has to stay for the night at a hotel. So they provide you the best hotels, everything. So he sleeps on the floor. Can you believe? Because of this reason. So he orders the hotel to give him a simple, firm mattress and sleeps on the floor. Because those mattresses which are there, they make you sink inside.
Yep.
Even the pillows which are there, they make you sink inside. So that sinking will ultimately sink your spine. And particularly if you're probably going for 2, 3, 4, 5 days for a holiday, it may not impact you. But if you use it every day of your life, it will impact you and it will start showing on your spinal health. So, coming to the treatment part now, which is also very important. Before I go to the treatment, something which is very common and which every one of us can do is that most of the ladies develop back problems because of wearing high heels. So, if you are having a back issue, avoid wearing high heels or for flats, uh, and practice the walking also proper. So if you start walking in the proper way, that also will start gradually impacting your muscles of the back. Then most important, which I think I was telling you initially also, each one of us should do in our day-to-day practice for a healthy back, which includes the cervical, thoracic, lumbar, the entire spine, is very simple. Just after every half an hour, go for a walk in your own room where you are sitting for 5 minutes. By the clock, time it out. Do not exceed 5 minutes because that is the amount of break you can give. And you'll be surprised at the amount of work output which you can create. So half an hour sitting is enough for the body. Just walk for 5 minutes to give the muscles a little bit of blood circulation so that they are again mobilized very well. And again sit for half an hour. We are not saying that you shouldn't work for 6 hours a day on the desk. You can. But after every half an hour, you have nowadays your mobile phones with you. Just put an alarm. After every half an hour, the alarm will bell and tell you, okay, come on, let's go for a walk. Just go and chat to your friend if you are in an office, or if you're at home, just walk in your drawing room or wherever you are for 5 minutes. And then after 5 minutes, you're back. So that also is a very big thing which will help you in your treatment part. Then we come to the correction of the posture. So if you have a person who's already had this problem for a long time and there you require help. So nowadays there are 2, 3 areas where I have found in my practice also, in addition to acupuncture, we also find a podiatrist who has got a very good role. Initially, maybe 10, 15 years ago, we never had any good podiatrists in our cities. Now, podiatrist services are available. And if you have an alignment issue and you find that, you are swaying one side or you're developing imbalance because of walking or your hip and pelvis is moving forward. So for all these things, a podiatrist is a person who can just put a little bit of a padding in your footwear, and that helps in getting a better balance of walking. So they also have a role to play if you have a disease which is getting chronic. But in the initial stages of disease, when the beginning is there, acupuncture is the treatment par excellence, and we'll go one by one as to how it will work. So first is the neck, as I said to you, the tech neck. So there, the muscles I've already told you, the sternocleidomastoid, the scalenes, and the trapezius. So we look for sore points in these muscles, which are the reason. And so many times you can actually find small nodules have developed there. And if you dissolve these nodules with needles, they work great. And along with that, give them a set of exercises to do at home. I will be sharing the videos of all the exercises with you. So you can share it as a link to all your students. And that they can, and they will be on different postures. Like for the neck, there's a different set of exercises video. For the mid back, there's a different set. For a lower back, there's a different set. For patients who are complaining of frozen shoulders, and difficulty in lifting the shoulders up when painful shoulders. They can even share these with their parents at home to make them live a better and healthier life, because exercise in any format is always good. And the exercise which we are giving out, they have been documented by a Japanese professor with whom I have worked closely for some time. And these exercises are very simple exercises, and they can be performed by any normal person. They are not exaggerated exercises, so they can never trigger any pains. They can at best only help you improve your posture and strengthen your muscles. Then, as I was talking to you about the acupuncture part, so a lot of people may be apprehensive about needles. So today in the modern world, we have needleless acupuncture, wherein instead of putting a needle at an acupuncture point, we can also use lasers. So soft lasers at acupuncture points are great. Then we also have a newer therapy. This is again developed by a Japanese professor known as prickling neurostimulation technique, or PNST, where instead of putting a needle, we just do prickling at the dermatomes. So dermatomes are the areas from where our actual nerve roots are going out. And this is all scientific, this is all pure science, and that is how it works. Then coming to studies. So first we are talking about the neck only. So there are documented studies now available for so the students of yours who are more Google oriented. They can also go on Google and search for themselves. They'll find random control trials and Alzheimer's journal, medical journals. There are published now studies wherein they've shown acupuncture to be of great help in such patients to get rid of such pains for good. And so this is about that part. Then we come to the kyphotic part. It is the mid spine. There I found a combination of acupuncture along with what is also known as cupping therapy. So a lot of people are not aware of cupping therapy, but the awareness suddenly grew because when they saw those marks of cups on one of the great Olympic swimmer. So it's everywhere the people started asking, "Oh, what are these marks?" So then that guy shared that he uses cupping very often, and his the sports medicine guy who works closely with him, he uses it. So it's very common nowadays. Even physiotherapists have use it, but ideally, frankly speaking, this was a science which was a part of acupuncture from the beginning. So cupping was used traditionally many years, maybe 1,000, 1,500 years ago also in a different format. Now we have specialized cups with plastic cups and all. Earlier they used to use just fire cupping. So they will just ignite a fire and put that cup over the area. And what it actually does is it increases the microcirculation to that area. So in kyphosis, where the big swelling starts happening around the mid spine, we can reduce that swelling, reduce the edema there by doing cupping. So a combination of acupuncture and cupping is very good there. Then for the hips and the pelvis moving forward, we have very good acupuncture points in the lower back and around the hip joint also, which can be used. Along with that, we also use what is known as moxibustion. So moxibustion or moxa is a herb which was grown in China, but now also in Assam. So we get a lot of our supplies from there. And this is a herb which is known to have a lot of medicinal properties. And in addition to giving heat to that area, it also opens up the blood circulation and it also soothes the nerves. So it's a very good treatment, particularly in patients who, if you press them at the area of pain, they will feel good. So if a patient feels good with pressure, means he requires heat. It's as simple as that. So if you get a patient, nowadays everybody says, I had an injury, so doctors told me to have an ice pack, but my pain triggered with ice packs. Correct. You see, because acute injuries, ice packs are good. But once the acute phase is gone, and if you go on using the ice packs, it can actually cause more pain. Why? Because the initial stages, the ice pack was used to reduce the inflammation. But once the inflammatory process is reduced and the patient starts feeling good with pressure, then the treatment to go forward is heat and warmth. So if you use a warm water bottle and some patients feel good with it, the reason is that there's reduction of blood circulation. Then the scientific studies of acupuncture, which have been done on this subject also, clearly depicts that the now the brain. So the when you put a needle, what happens? So a lot of people will ask me, how does a needle help? So the simple understanding is, as soon as you put a needle, you're actually sending a signal to the brain. And from the brain, the neuropeptides and the pain-killing opioids, which are always present in our brain, get released. And they go to that area where the needle was put and give pain relief. So that's a very, very scientific method. It's a WHO recognized system of medicine now. It's being practiced as an independent healthcare system in over 130 countries globally today. Surprisingly enough, we have been a bit slow in getting to that level. I'm already working on that with the government of India. And I'm confident that maybe in the next 6 months to 1 year, we should be having colleges on acupuncture in India also, like we have in the Western world. All of Europe, all of US, Australia, UK. I've traveled everywhere. There are independent colleges of acupuncture, wherein after class 12, you can do a diploma course or a degree course in acupuncture, 3 years to 5.5 years duration, and you can start practicing. And but you get a degree which is known as a licensed acupuncturist. That means you have a license to practice acupuncture. And then the important guidelines on practicing is that you are given a limited scope of work, which means that suppose a patient comes to you with a heart attack, you're not going to use acupuncture in them. So they accordingly will be training you to be able to identify that this is not your area of work. You need a specialist doctor for that. And even in emergency rooms globally, I have found they are using acupuncture. Suppose a patient comes with an acute attack of asthma, they're even using it there. So there is no limit to the use of this science now. As a matter of fact, a recent WHO report published in 2023 for the next 5 years, 2023 2028, shows that the system of medicine accepted globally after Western medicine globally is acupuncture. Even it was a surprise to me, which means it has really grown in popularity globally, which is a very good sign. And most of these Western teams of Olympics, where they go, or even for athletes, wherever they travel, they have a acupuncturist as a part of the team which goes with them. He could be a physiotherapist who has trained into acupuncture, or he could be a medical doctor trained into acupuncture. But because in sports medicine, acupuncture has a major role to play, even in injuries and back injuries and calf, hamstring, tight calf muscles which they develop, you can just give one session and the guy is ready next day. And that's what they are looking at. And then today, with the doping system so tight all over the world, they want to avoid medication. So acupuncture is a way to go forward. No medicines, nothing to go from the oral route, and it's your own system. As a matter of fact, in China, when I was there maybe about 10 years ago, I was surprised to see that a lot of these Chinese used to be use small ear needles in the ear, which ear acupuncture is a treatment protocol in itself. And so there are few points of acupuncture at which, if you put these ear needles, which are retaining needles, you can actually enhance your productivity of by releasing natural pain killing substances. So, and this will not be caught by the doping agencies. Why? Because you are stimulating your natural humoral mechanism. You are not taking anything from outside. So there is a lot, which we should learn from others also globally. And that experience always is going to count. And that, I think, will be of great help to us also when we are looking at sports injuries in our own country.
That was very helpful, Doctor. I have two other very small questions for you. Um, the first one is 10,000 steps a day. There's so much conversation around it.
Yeah.
What
Yeah.
are your thoughts on it?
See, I am a big, very favorable for walks because one, the exercise which we have to do every day, uh, walking is the best out of that, and particularly in people who have cross the age of 45 or 50, for them, walking to me seems to be the best alternative, because gymming to me is not a very good idea at that age. Why? Because most of the time in a gym, they are asked to walk on the treadmill,
Right.
and that treadmill walking actually starts having an effect on your knees. So a lot of these patients may develop actually arthritis if they use treadmill too often. So I would say anybody who's 50 plus, if you want to do some muscle building, okay, you can go to the gym. Avoid the treadmill totally. And the best exercise is walking. So whether it's 10,000 steps or not is not important. Important is 30 minutes of walk, at least 5 to 6 days a week is what I would always advise, which is very good for everybody.
Noted. One more question I have is a lot of these MBA students who I meet, in their 24, 25 age, sometimes they get a medical test done, like a typical blood test, and something comes out. And, I'm older now, so I always tell them there's no harm in getting tests done. And now I guess you should get it done even earlier than we would get them before. One, do you think that's a good idea? And maybe at the age around 25, what set of tests should students get done? Just a routine test, to be aware of their health and possibly anything else that comes out of it.
I generally would, I'm not a very big favorite of getting blood tests done routinely.
Okay.
Uh, I would only suggest that if you are having a family history, it means any of your parents, don't go beyond that. Any of your parents or your brother or sister has got diabetes, hypertension, or thyroid issues, then it is important that you get once a year done, not more often than that, to pick up if you are going that side, or if you have bad eating habits, as a result of which you are gaining weight. So there it is not a bad idea to get your lipids tested and all, because then it is a good idea. Other than that, routinely it shouldn't be done. But now, with what I'm seeing in my practice, and a lot of people talk about it also, with the lack of exposure to sun, we all are developing vitamin D deficiency. So this is one test which I would strongly recommend even in younger people. So maybe you are 20 or 25 or whatever age, once a year, not more than that. And if you are find your levels of vitamin B12 and D3, these are the only two tests, are within normal range, it's fine. But if they already started dropping, then you need to have a supplement. And
Right.
moreover, the problem is that vitamin B12 is also quite deficient in the vegetarian diets. So a lot of vegetarian people develop vitamin B12 deficiency. So not that I'm asking them to switch over to non-veg. I am saying please follow your vegetarian diet. It's a very good diet, but you can also start using a supplement along with your diet. So that will help. So I think these are the two tests which are good.
In fact, I do have a follow-up question. Bill Gates was in India recently, and he was on a podcast where he was looking fitter and, better. And when Nikhil Kamath of Zerodha asked him, he said, I take multivitamins. And he said, I don't see anything wrong with it. I mean, it can either help you, at worst, it will have no effect. So, and a lot of students are now asking me if Bill Gates is saying it, there must be some merit to it. So, what are your thoughts on the multivitamin part?
See, I would say that if you have a lot of money in your pocket, go for it. But
Right.
sensibly speaking, I am totally against the idea of putting so much into your body, because at the end of the day, they will be thrown away by your system. Because most of these vitamins, uh, if they are water soluble vitamins, remember that also. So, water soluble vitamins, if they are not required by the body will clear it through the urine. But if there are the water insoluble vitamins, which are vitamin A and vitamin D, and if you take too much of that, they can actually damage you. So be very careful and don't just blindly follow anybody, and because this is not the in thing. We have to be also sensible enough, like he's saying, that whether it affects you or not. If it is a vitamin B or it's the so many times you see excess of proteins can damage your kidney. So we have to be very particular in deciding what is good for our body. So, if you actually are developing symptoms and you are, it's like extreme fatigue or tiredness, or irritable bowel syndrome, too much of stress, anxiety, which is very common, and that is leading to physical symptoms. I think it's very important for any one of us to consult a medical doctor. It's not a bad idea at all. And particularly if you are in touch with a nutritionist, it is even better.
Right. My final question is more philosophical in nature. And we have had this discussion before. Students always feel that the world is worse than it was. There are lesser jobs, there are fewer opportunities, others are doing better than us. Social media, we know, is a big cause for that. And I keep on telling them that if you want numbers, we are probably in the best phase of humanity, right? I mean, there are no wars, everybody is peaceful, the quality of life has improved. Of course, there's a lot more to do, but generally, number wise speaking, I'm sure that civilization today is better than we ever were, right? In the humanity, history of humanity. But all this is something I understand now. But students generally are in that attitude that there's depression, and even when they are successful in terms of money, they are probably not happy. And I tell them, what is the definition of happy, right? I mean, happiness doesn't come without pain, right? And I was reading a book, Doctor, a couple of days back, which said that um, the biggest pleasure is to delay pleasure or to avoid pleasure. So the moment you say that, okay, I like it, but I will force myself to not do it too much, that in a way is going to give you pleasure, right? Because you're abstaining from it. So again, all this sounds very philosophical, but students generally, I've been teaching for 15 years now. There is definitely a difference, right, in the attitude that is there. They might be better off because there are more opportunities now. They are getting paid more. Now you have EMIs easily available. At least on face value, it seems quality of life is better. And I think this is a global problem that, they're just not mentally there. I mean, what are your thoughts on it? And, what would be your 2 cents on, what students should think?
So, if you are asking me, I will also reply to you on a philosophical note that what changed me and my life happened about maybe 10, 12 years ago. And that is what I now share with all my patients who come to me. And this is something which is uh, maybe the younger generation doesn't want to talk about it, doesn't want to pick it up. But I think uh, once they listen to me carefully, they would want to pick it up. You see, because what's happening today is that we are trying to become a developed country from a developing country, right? Modi ji is also promising that we will become the third largest economy in the world. The question is, what is the change which it is causing to our health? And the answer is right there. We have become the biggest nation with diabetes in the world today. So, diabetes, hypertension, heart diseases, the three biggest killers, and stress and depression. These are the four biggest diseases in the developed world. And we are now becoming a part of the developed world. So, we already have these four diseases. When we become developed, that's different. But we already have the four problems. And in big scales, because of our bad eating habits, because of lack of exercise, because of bad posture. So let us try and go to the root also, not think in terms of only financial health. I, uh, uh, Avish, being a very open-minded on these things, I really feel that people, I have a big staff working with me. So I find that the happiness doesn't lie in the amount of money they are earning from me, but the amount of happiness which we create in our practice of cheerfulness. And very important is that that has to come from the top. So if I am a person who's all the time sad and gloomy, I will not be able to pass that energy. So this is called energy medicine today. So what is energy medicine? Is the type of energy you zoom out. So if Havish, as a teacher, is not zooming out positive energy, how will the students pick up positive energy? So this positivity can be attained very easily after what I learned 10 years ago from a very known person you must also have heard her name, Sister Shivani. She
Right.
is a part of the this sect of uh, organization, which is doing great work. The uh, Brahma Kumaris, and they have offices almost every corner of the world. And you look for a Brahma Kumari center near your residence, and you are bound to get one in a distance of just 1 to 2 kilometers. That is the number of centers they have in India. So I would strongly recommend, and it is not a very big thing to do, just 1 week of visit to any of these centers and do a 1 week program with them, and only 1 hour in a day. And that 1 hour in a day can be chosen as per your liking. So they will give you a time as per your liking. If you want a 7 to 8 a.m. slot, they are happy to that. If you want a 5 to 6 p.m. slot or even a 7 to 8 p.m. slot, they'll be happy to do that with you. So what they teach there is very simple. They tell us about our mythology. They tell us about the four yugs through which we have to all which we have already passed through, that the Satyug, the Treta, the Dwapar, and now we are in the Kali Yuga. So we have to understand this is not philosophy, this is the truth of life, that we are in the Kali Yuga. And in the Kali Yuga, destruction has to happen. But if we keep our mannerisms and our energy levels good and do good to people and do not uh, take the karmic journey of others into our lives, we can still lead a very healthy and happy life. So, happiness does not come from money. You have already cleared that. And I have seen that not in one, but plenty of patients who come to me, that people think from the outside that this guy is coming in a Mercedes and he's got a driver, he's a chauffeur driven guy. But God has given him an only one child, and that child is also mentally retarded. So he will go all over the world, but there is no treatment for that. So, what I'm trying to tell you is that money does not get you happiness. And this is not one, I've seen many cases like this. So, there is a balancing factor which God has in his hand. So, try and understand that and be happy and contented with what you have. There is no harm in trying for doing better. There nobody stops you from doing better day by day, working hard. But don't overtax your body, because that will affect your health. And if you are not healthy, you will not enjoy what you are also earning. Have short breaks, go for holidays, enjoy nature, connect with nature. So these are all things which Sister Shivani talks about. And the at the end of the day, she always says that do not start your day in the morning with tech, with your mobile. So straight away, opening thing of the day, we open our mobiles and see. And what will you read there? About murders, about rapes, about negative news happening all over the world. So do not start your day, because that is the energy with which you start your day. So start your day with something more positive, with listening to some nice music in the morning, which is meditative. And end your day. The last thing also she says, do not use tech. At least 1 hour before you go to bed, please stop all your devices and try and listen to a meditation music. What I do is, sister has got a very simple YouTube video, which is meditation video, audio also. I just put it into my ears, and I don't even come to know when I'm going to sleep. It's such a beautiful audio. So these are simple things. They are available for free, and the best part of the Brahm Kumaris is they don't charge you anything. They don't charge you a penny for this 1 week course. All of us must go and attend this course, because it is a real awakening of your actual energies. And then you will be actually surprised that you start smiling every time, because she tells us that look, your journey is your own soul's journey. And a person who's your father, your mother, or even your friend, his journey is different from you. So today, if your anybody in your family also talks badly to you or talks rudely to you, it is his or her karmic journey, not yours. So please do not change your karmic journey because of the foul mouth of another person. It may sound difficult, I'm telling you. It took me maybe about 6 months to 1 year to imbibe that, but now I have imbibed it into me totally. So at the end of each day, she says, this is the third eye. And there is an acupuncture point also here. This is a very important point we use. We also call it the eye of Shiva. So this is third eye. And at the third eye, all the negative garbage of the whole day we store here. So she says, before you go to bed, clean the garbage here. And how do you do that? By forgiving people who have even said, talked wrongly to you. He says, next morning when you get up, you will be a totally pure soul. And I am following it to almost 90%, 80%. I've changed myself. And I have found a major change in myself because I don't carry the karmic journey of another person with me because he or she had to do it. This is what the sister tells me. Even if you have tried hard that your son should not misbehave with you, he will still misbehave with you. Why? Because this is his karmic journey with you. So if you start only thinking about that whole day, whole life, you have ruined your life. No need to do that. Try and forgive him and still give positive energy to him, saying that, look, you have said bad to me, no problem. I still forgive you for that. And I wish good for you. And maybe in the next 6 months or 1 year or soon, you change for the good. You will actually start seeing changes in such people also. But if he or she still continues to do it, please and please do not make it a part of your living. So I think these are very important words said by very important people who are into the I would say the healing of the mind and the body and the soul. And those all these things should go hand in hand for making us better human beings, and not just that feeling of wealth. That wealth is not health. That wealth can be only temporarily giving you happiness, but a permanent happiness is not there with wealth. Wealth, I would call a wealthy person a person who has got parents who are loving parents. And if the child is looking after his parents, if a child, when he grows up, looks after his wife and children, that is a person I will call as a healthy person, not a person who goes out at night and parties till 4 a.m. and sleeps at 4 a.m. every day. Once in a while, I don't mind. Once a week, once in 10 days, do it, no problem. But when you do it every day, you have started ruining your physical health because your liver wants to sleep at 3 a.m. and you are asking it to get up. Good, get up, digest my food. What will he do? He will not be happy with you. So try and understand the yin and yang philosophy. The yang philosophy is daytime is yang, night is yin. So work in the daytime, sleep at night. The organs also want to sleep after 9 or 10 o'clock. Do not make them awake till late night. So all these factors are going to be very important when we look at overall health.
Right. Thank you so much, Doctor. It's always a pleasure listening to you. I'm sure everyone will benefit a lot. I think these were very practical tips. And even though I'm telling you, no student will want to listen to it, they must. That's the difference. And I'm going to make sure to spread the message because I know how important it is. And I feel it's my duty to make sure as a teacher to ensure that people listen to this.
Thank you very much.
Thank
Thanks
you
for
so much.
inviting me.